Good morning, Pete and I's Daily Show. Happy Tuesday morning. Hope your day is off to a great start. My name is Alan. We're here on Clinical Tuesday. Happy to be your host today. Currently have the pleasure of serving as the Chief Operating Officer of the Institute of Clinical Excellence and a faculty member and our fitness athlete. Today, Clinical Tuesday, we discuss all things clinically related, manual therapy techniques, strategies for working with patients. A couple courses coming your way. Virtual ICE registration opens today and it closes next Tuesday. So if you've been hoping to get into virtual ICE, $29 a month. We meet every single week with a different presenter, sometimes ICE faculty, sometimes outside invited guests. Today, for example, we're going to have a great presentation tonight from Dr. Chad Cook. Many of you are familiar with Chad. He's a fantastic lecturer from Duke and a great researcher and a great aid to our profession. So he'll be joining us tonight. We just had a series on vestibular from Alex Germano. So if you're looking to find out more about virtual ICE, you can go to ptonice.com/virtual-ICE. Or check out our upcoming schedule, which has been posted on social media. You'll see a post go out today at noon with the next quarter's schedule. That registration is only open for a week, and then it closes for the next 3 months, so make sure you jump into that. Bonus, you get 24 CEUs if you stick around with us for a year. If virtual ICE doesn't suit your fancy, we have some live courses coming your way. You can join Mitch Babcock down in Atlanta this weekend for Fitness Athlete Live. Jeff Moore will be out in North Platte, Nebraska for cervical spine management. Jordan Berry will be down in Phoenix, Arizona for lumbar spine management. And then Mark Gallant will be up in Bismarck, North Dakota for extremity management. And then next weekend, you have another chance to catch Mitch Babcock with Fitness Athlete Live. Next weekend, he'll be in Hazlet, Texas, which is right outside of Dallas. And then we also have Fitness Athlete Pregnancy and Postpartum starting online today. That's your last chance to jump in to that cohort. So if you're hoping to get into that cohort, today is your last day. You can join Mitch and myself for Fitness Athlete Essential Foundations. That starts next Monday, so still some time to jump in there. And then you can join Jason, Megan, and Rachel for Fitness Athlete Rehab of the Injured Runner online. That will start September 21st in a couple weeks. So that's what's coming your way course-wise. Let's get into today's topic. Today's topic, we're talking about goal setting for the inactive patient. So we all love to have athletes and higher level active recreational folks in the clinic. They come in with goals, right? They're very, very easy to work with from a what's going on, what are we trying to get back to perspective, right? That CrossFitter who comes back in and says, I have pain with muscle ups. That power lifter who comes in and says, I have pain with squatting or bench press. That runner who comes in and says, I'm having issues with running, right? It's very clear goal setting what we're doing with those people, right? They come in and tell us their goals. I need to get back to X. I'm being limited by Y. And sometimes they come in with a time frame, which is even more fantastic. I need to get better by Z date. Right? I have a marathon coming up, I have a competition coming up, that sort of thing. So it's very cut and dry with some of those folks as far as what we need to work on and the time frame that we're given, right? We love to work with those folks. We wish sometimes that those were our only patients, but we know that's not the case. So what about the inverse? What about that person who comes in and maybe they have a referral from their primary care physician for maybe some pain or weakness or something, and they come in and they say, I'm here because the doctor told me to come here, right? And we're having a really hard time figuring out where's this person going, right? What's the end goal here? This person doesn't seem to be doing anything. They seem to be really inactive and sedentary. Like, what are we trying to get back to doing? This person doesn't really do anything, right? This person maybe works at a desk all day, or maybe they're already retired and they're not really doing much of anything. So that person can be very hard to write goals for and try and get an idea of what are my benchmarks? What are we trying to do? What does our timeline look like? What are we even going to work on, right? Maybe this person does come in with a pain diagnosis, but beyond that, what are we really working on? So that can be a much more difficult patient to work with. So I want to talk about a couple different points today. I have 4 points today. The first point is to move beyond pain, right? We are so caught up as being the pain people. People come in only with pain. We treat pain. When pain is gone, we kick people out the door and get some more folks on our books who have active pain. We have to get much more comfortable moving beyond pain as a benchmark. That's easy, and often it clears up quite fast with some stuff with our hands and some stuff out in the gym. And then what, right? Oftentimes, far too often, we kick these people out once that pain has cleared up and we say, pain's gone, good luck with your life. And we know those folks, if they don't end up in our clinic very soon in the future, they're probably going to be in somebody else's clinic, or they're going to end up getting surgery, or they're going to end up on medication, so on and so forth. So how can we capture these people and keep them from falling downstream in a negative way? So the first point is move beyond pain. We have to figure out, what is this person doing in their daily life? Yes, their hobby, they might tell you, might be watching TV, right? They might be a retired person. Maybe they sit on the computer for work and they're very sedentary and they seem to just sit and lay a lot. But what do they do in their life? We have to dig deeper. Do they have kids? Do they have grandkids? Do they have a dog, right? Is there anything in their life that we can relate to some sort of physical activity beyond just 1 out of 10 on the numeric pain rating scale? And then compare that stuff to different functional stuff we can have them do out in the gym when we start to get them exercising. A lot of folks will often ask, why am I doing this? Like, why am I picking up this kettlebell from the ground? Why am I carrying this sandbag? And it's kind of on us to relate that to the things they want to get back to doing, right? Maybe they have grandkids. Well, if we can pick up this kettlebell from the floor and get stronger at it, that's going to translate into you picking up your grandkid off the floor a lot better. Swinging this kettlebell is going to translate better to swinging your grandkid when you're playing with them, right? Carrying a heavy sandbag is going to strengthen your upper back and your shoulder muscles to be able to carry your grandkid around when they come to visit you and you want to babysit, right? So finding those things in their life and relating them to function. I had a patient of mine picking up a sandbag and then cleaning it and then pushing it up and over the yoke. And when I first set it up, she said, "What are you having me do? Like, why am I doing this?" And I said, "You told me you can no longer get the dog food from the porch when Amazon drops it off and bring it to the house. It might sit on the porch for days or weeks before you can find some help to bring it inside and put it in the cupboard. This exercise is going to practice the foundational movements for you to do that yourself, just like you were able to before we kind of got sedentary and a little bit deconditioned." So relating those functional things works a lot better than just focusing on reducing the pain and figuring out what is actually needed in this person's life. Is it leg strength? Is it back strength? Is it power training, right? Is it cleaning a sandbag or cleaning a pair of dumbbells or kettlebells or something like that, and training that triple extension power that translates into things like being able to lift up the dog food from the floor and put it overhead in the cabinet. So making sure we're focusing on function as much as possible. And this ties really closely into the next point, which is making sure that we make exercise successful, approachable, and fun, right? Oftentimes, PT exercise looks very boring, right? It's laying on a table and just moving bands and dumbbells around in a bunch of very arbitrary patterns that doesn't seem to translate very well to what folks do out in their daily life. So making sure that it's fun, right? Folks have fun when they tend to get a little bit sweaty, when they get to use new machines and new movements they haven't been exposed to, versus if they're just on the table the whole time squeezing a ball between their legs, right? That's very not fun. It's very hard to connect the dots there on how that's going to make them better, not only pain-wise, but function with the stuff they want to get back to doing. And building on those small steps can be very successful, right? Getting somebody out, even day one, a kettlebell to 2 or 3 bumper plates, right? A massive block. You might think, well, we're probably not strengthening that person too much. And that's fine, right? I have to sell that person on physical therapy so that they come back another day, right? I'm not just trying to blow it out of the water on the first day. I want that person to come back 2 to 3 days a week, so I have to make it smart, successful, and approachable. Dustin Jones and the folks in the Modern Management Older Adult Division would say intentionally underdose some people, right? We have the desire so much to make sure they're lifting above 60% of their max and that we're at 80% heart rate or above, just like the research says, and we forget that if we totally crush a person and make it miserable and not fun, it doesn't matter. We're never going to change their life if they don't book another appointment, right? If they go home and think, screw that, I'm not going back there. If we make it fun, we make it successful, we build those folks up, we high five, and they come back on Thursday, that's how we can actually change their life with that small step approach. So point 2 is make it approachable, make it fun, and make it successful. The third point is to treat people like athletes. When they come in the gym, I'm a big fan of this. When they come in the clinic, they come in the gym. Treat them like an athlete and they'll start to behave like an athlete. We don't need to necessarily bombard people on their first day and try to fix everything that is going awry with their lifestyle, their sleep, their nutrition, their diet, what they're eating, what they're drinking, alcohol consumption, all that sort of stuff. We don't need to tackle all that stuff on the first visit if we just take the approach of treating this person like an athlete. We have them out in the gym, we have them exercising hard and heavy. They will naturally start to ask questions like, could I be eating any different to make this more successful? Is there a way I could change stuff I'm doing at home that would kind of aid what we're doing here in physical therapy? And of course the answer to that question is yes. And that is the light bulb moment with these patients that are inactive, is when they start to ask questions about, how can I change my diet? How can I change my sleep? Is there stuff I could be doing at home? Those are all the right questions that we want to hear without necessarily pushing all that stuff on them, especially the first day. It can often seem like we're picking on these people when they come in. They're inactive, they're not eating well, they're not sleeping well, they're probably drinking a bunch of alcohol. And if we start to dig into that stuff on the first visit, it can seem like, here's everything that's wrong with you, right? Which they're probably already getting that approach from their primary care physician. They don't need it from us. Get them out in the gym, get them moving, and you'll be surprised that behavior change starts to occur naturally as people wonder, you know what, I think I could stop at the gas station and get one of those protein drinks. I think I could go to the store and get some of those protein bars and have those around the house and snack on those instead of gummy bears and potato chips. So treat people like athletes, and you'll be amazed that they start to behave like athletes and ask you questions that relate more towards performance and less towards getting out of pain. My last point is asking yourself, and this can be very hard, am I the right physical therapist for this patient? And the answer to that question can sometimes be no, right? Whether it's a personality conflict, you're just not connecting, or it's a belief issue, right? If you come here, we can't give you ultrasound, we don't have a machine. We can't give you laser treatment, we don't have a laser machine, right? We're very upfront with folks in the first visit, in the initial evaluation, of folks who come and see us off the street, who are otherwise inactive, look, therapy here maybe looks a little bit different than you've had in the past. If you've never had it before, great, because you're going to get it, we think, the best way to have it. But it's going to be a very active approach to getting you better. We're going to be out in the gym a lot. It's hot out there. Dress to move. You're going to be sweating a lot. Bring some water and get ready to basically train, right? No different than we do when folks come into the gym side of stuff and prepare to take a CrossFit class, right? And ask yourself, am I the right therapist for that person? And be honest with those folks. If you want to come here and get 60 minutes of ultrasound or laser or massage, we're just not going to offer that. We, of course, know expectation drives outcomes, but at some level, we can't just lay on the table and get ultrasound treatment for an hour. We know that's not going to translate into somebody feeling better. So make sure you're asking yourself, am I the right therapist for this person? Is there somebody else on staff who may be able to connect with them more, who's maybe more aligned personality-wise? And at the end of the day, are we being intellectually honest with ourselves in that patient of, am I the right person to move them forward? If they are so dead set on inactive passive treatments, we need to let them know this may not be the right place for them, and we have to kind of let that go, that they may go on somewhere else. There are definitely some other places in town who would love to bill you $500 to lay on a table and get ultrasound if you're convinced that is the only way to get better. But if you're coming here, we set that expectation early on in the initial evaluation. Most patients getting out into the gym, even on their first visit, it looks different here. It's much more active. We're going to ask a lot more of you, and our goal is to get you better faster and help you reach those goals that we've agreed upon setting for you. So step back and ask, am I moving beyond pain, or am I just tracking pain? Am I just tracking range of motion? Am I just tracking manual muscle test as measures of progress, or am I looking at function? Can I sandbag clean 40 pounds and throw it over the yoke, because that's how I'll get my dog food in the house? That's a much more realistic goal for somebody who is not active and performing exercise on a daily basis. Make sure we're making it fun, successful, and approachable. We want the patient to come back. We want them to have a good time. Them coming back visit over visit is how they make those small steps towards success. Make sure we're treating them like athletes. We're asking them to do a lot more actively when we're using our therapeutic exercise. And don't be surprised when they then start to ask questions about performance-based stuff, right? About diet, nutrition, sleep. We don't necessarily have to force those conversations on people. Sometimes they will happen naturally if we take the approach of treating people like athletes. And then finally ask yourselves, am I the right physical therapist for this person? Is there another person who's maybe a better fit personality-wise? Or have I not been honest with this person that therapy here is the way we do it and not a more inactive kind of passive approach that some clinics take? And making sure we have that conversation as early on in the plan of care as possible so that we don't have somebody stuck in a couple visits who says, you know what, this is not for me, I think you need to go somewhere else. We want to move those people on to a different provider as soon as we possibly can to make sure that they get the outcome that they are seeking. So those are the 4 points I want to talk to you about making goals for inactive patients and helping those patients reach their goals. I hope you all have a fantastic Tuesday. If you're going to be at a live course soon, I hope to see you soon. My next live course I'll be at is going to be into September here in Denver for Total Spine Thrust with Justin Dunaway. I'll be taking that course to audit it, so if you're going to be in Denver, I'll see you then. Have a great Tuesday. Have a great week. Bye, everybody.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.